Hello and welcome, and for many of you, welcome back to today's panel hosted by the Council on Criminal Justice. Today, we're honored to present a discussion with Representative Bobby Scott of Virginia, followed by a panel of experts from community-based and reentry programs across the country. I'm Abby Walsh, the Council's director, here with just a few housekeeping notes before we begin our program today. We'll be joined by nearly 500 participants, so to ensure a quality experience for everyone, all lines will be muted. But we want to hear from you, so throughout today's session, you can submit questions using the Q&A box at the bottom of your screen, or email us at info@counciloncj.org at any time during the call. We have a packed agenda and lots to discuss, but hope to turn to your questions before the end of our time. With that, I'm pleased to introduce John Tilley, Council Senior Fellow and former Secretary of Kentucky's Justice and Public Safety Cabinet. John, go right ahead.
Well, thank you, Abby. And as always, welcome to our call. First and foremost, we hope all of you are safe and well watching at home or safely from your offices. Again, I'm John Tilley, a Senior Fellow here at the Council. We've got a great panel here today. We hope you're joining us for the fourth time. This is now our fourth call in this series, the latest on COVID-19 and the criminal justice system. We've covered law enforcement, courts, and most recently corrections. Today, the all-important topic of communities and what's happening on the ground. In case you're just joining us for the first time, a quick word about us here at the Council on Criminal Justice, or CCJ for short. As many of you know, we are an invitational membership organization and think tank for the field, a center of gravity, a sensible center for many, as we've said. A mission to be guided by the facts, the evidence, and justice most of all, and certainly a panel which will talk about those very principles today. Tuning in, so many of you, leaders and voices in the field, but council board members and trustees, federal, state, and local officials, law enforcement, the military, as we've said, corrections, and the courts, researchers, advocates, and of course the media is in line with us today. The critical issue, as we've said, communities. This panel is so well poised to talk about the huge challenges facing families, the loved ones coming home to them in the places we live and work. And joining us first will be the Congressman, Robert Bobby Scott from Virginia, the Chairman of Education and Labor, but before that, a key member of Judiciary, has worked in criminal justice. And in one thing, Congressman, before we come to you with the first question, I was struck by our visit in the fall, your passion for this topic, for communities and criminal justice reform, the nation's system, but also something I did not know about you at that time, which I've come to know, that you're so connected in many ways to communities. You started early in your legal career by establishing and founding a legal aid society there in Virginia. And that struck me as someone who's worked in that field. And again, you put your money where your mouth is for years. So let's start with you and tell us what's going on in Congress with regard to COVID in communities and the criminal justice system.
Well, John, thank you for your comments. It wasn't started with my money. I established the Federal Legal Services Corporation affiliate in Southeast Virginia. So it wasn't my money, but it was certainly a passion because people need that kind of representation. I'd like to thank the Council on Criminal Justice for hosting the webinar. As many of us are under stay-at-home orders, the virtual discussions such as this one bring people together to discuss things like criminal justice and other issues. We can certainly understand the unique challenges of COVID-19 pandemic, and we could work towards a solution. The Council on Criminal Justice's work at this time is as critical as it's ever been as we come to producing sound evidence-based solutions. And I say evidence-based because that's usually the challenge and really the choice we have as to whether we're going to pursue criminal justice policy based on evidence or based on poll-based sound bites and slogans. This crisis has revealed fundamental inequities in our society. We've seen how it has revealed inequities in healthcare. Disproportionate number of minorities are dying. In the education areas, the achievement gap is exacerbated by virtue of the fact that many children do not have connectivity, so distance learning cannot take place and they just fall further behind. And just like the financial crisis of 2008, low-income families, communities of color, and more than 2 million men, women, and children are currently living behind bars and bearing a disproportionate effect of this pandemic. COVID-19 is spreading rapidly through our jails and prisons. And that shouldn't be a surprise to the people listening today. Under the tough on crime approach, no matter how tough you were last year, you got to be tougher this year. It's been getting tougher by the year for about a quarter of a century. Since 1980, we've gone from around 350,000 persons incarcerated to over 2.2 million. That has nothing to do with the crime rate and has nothing to do with the population rate. It's all tough on crime, lock them up and throw away the key, with no connection to the effectiveness in actually dealing with crime. As a result of these approaches, the United States is the leading incarcerator by far. The world average incarceration is about 100 people per 100,000. The average rate among states today is about 700 per 100,000. Some states lock up minorities at the rate of 4,000 per 100,000. The United States has some of the most severe punishments for crime, especially for juveniles. Of over 2,200 juveniles sentenced to life without parole nationwide, all but 12 live in the United States. Some were given sentences for first-time offenders under circumstances such as being a passenger in a car from which there was a drive-by shooting. Under proposals before us to expand the definition of gang and treat conspiracies and attempts the same as a commission, we'll see much of those fringe-involved young people serving life without parole sentences. Our addiction to mass incarceration has led us to critical moment where almost half the people living in the United States have a family member who has been or is currently incarcerated. Research has revealed a racial disparity. Black, Latinx, Native Americans are much more likely to be incarcerated and receive longer sentences, and the racial disparity in our criminal justice system is apparent in study after study. All of this brings us to the current moment of the crisis of COVID-19. Prison facilities make it impossible to socially distance. Many of these facilities do not have enough adequate hand washing facilities. We have a nationwide shortage of PPEs and absolutely no leadership from the White House on rapid testing, which is the #1 request from correctional officers in my state. Now, in the midst of this pandemic, some are beginning to see a different path. California has released about 3,500 people from its prison system. A Kentucky governor will commute sentences for about 1,000 individuals. In my home state of Virginia, our General Assembly and the governor have passed a measure to release 2,000 individuals from state custody. And while that's a start, we need to drastically reduce the size of our prison population if we're going to slow the spread of COVID-19 in our correctional facilities. Releasing individuals from incarceration is not enough. One thing that we've been pushing in all industries is a enforceable OSHA regulation to make sure that the workplaces are safe. If we can protect the workers, we naturally have to protect the prisoners. And OSHA right now has no enforceable regulation for protecting workers against airborne infectious diseases. There has been a pending proposal at OSHA for the last 10 years, and they won't move on it. In January, ever since January, we've been asking them insistently to try to have an enforceable regulation. Now, they got little guidelines for a couple of industries, but no enforceable regulation to make sure that places are safe. And there are a lot of things you can do: wearing masks, separation, testing. There are a lot of things you can do, and people ought not have to make it up. There ought to be some guidance, some specific standards from OSHA to make sure people are protected. We also need to provide individuals in the communities they're returning to with reentry services and programs that help them avoid the revolving door of prison. Housing, healthcare, counseling, employment services, financial support, nutrition services. Those are some of the things we can do to turn the tide against mass incarceration. And we should use this moment to address the root causes of recidivism, which is not criminality, but access to the support system that keeps people healthy, housed, and employed. On the federal level, my colleagues and I have been negotiating the next relief package. We're calling it the HEROES Act, and there are several items on the agenda. One is that the initial economic impact payments of $1,200 excluded individuals who are currently incarcerated. Extending those payments to individuals who are scheduled for release or released through an emergency order should entitle those individuals to those kinds of payments. The April job loss shows how the depths of the crisis, with unemployment reaching Great Depression levels, individuals returning home from jails and prisons will be in competition with even a larger pool of people for fewer jobs, making it even more difficult than usual. Having a criminal conviction, as everyone in this call knows, makes it much more difficult to get a job. Formerly incarcerated individuals who have successfully transitioned and started a small business in their communities are having difficulty accessing the Paycheck Protection Program loans, while publicly traded corporations are being awarded millions. We need to make sure that economic assistance during this crisis does not bypass the very communities that need it the most. In several states, Medicaid coverage is not just suspended, but actually terminated during incarceration. That means an individual suffering from mental illness who depends on medication to treat his or her illness will find themselves at a month or two lag in medication as they exit the criminal justice system and re-enter the community and have to apply for Medicaid all over again. And that's why I've introduced in the House the Supporting Positive Outcomes After Release Act, which prohibits states from terminating an individual for Medicaid coverage while they are incarcerated. Trump administration is well known for its targeting of low-income families, immigrants, and especially children prior to the crisis. So many individuals in the White House are using this pandemic to further restrict access to federal food and nutrition programs. Children are already out of school, and many are missing the only reliable meal they had access to during the day. Removing the lifetime ban on SNAP and TANF benefits for individuals with a felony drug conviction is essential to ensuring formerly incarcerated individuals and the food security of their children and families. This session, I'll be reintroducing the Safe Justice Act, the Safe, Accountable, Fair, and Effective Safe Justice Act, which takes a broad-based approach in improving the criminal justice system through prevention, police training, elimination of mandatory minimums, more services in prison, and more services for second chance programs. A start to finish idea that if you use an evidence-based approach, you can reduce crime and save money. That's a successful reform package that's been enacted in many states, and they found that they can not only reduce crime, but also save a lot of money in the process. Legislation that focuses on humanity and the potential of incarcerated individuals, rather than slogans and sound bites, is essential. That's really the choice we need to make, whether we're going to follow the evidence and research or poll-tested slogans and sound bites. Unfortunately, you can't do both, but once you've made the decision, the rest of the decisions are easy. We have a very interesting panel today, and I'm going to try to stay on, but I have a call I have to get on with my colleagues who are developing the next COVID-19 legislation. And so I'm expected on that call, so I'm going to try to monitor. I try to do both at the same time. But John, I appreciate all the work that you do and the Council on Criminal Justice has done over the years. And I look forward to working with you in the next few months and in the years to come. Thank you very much, John.
Oh, thank you, Congressman. And you said a few things I know that'll kick us off our discussion. You mentioned the importance of being healthy, housed, and employed. And this panel is perfect to discuss what that means to those reentering, what that means to communities. And thank you for the legislation. Thank you for your commitment. And I know you wanted to stay and listen to continue to learn what is needed on the ground. So speaking of that, I'm going to introduce our panel very, very quickly. Hope you can stay with us as long as you can. Congressman Eddie Bocanegra, a trustee at the council, is with us, the Senior Director of READI Chicago. Ellen Donnarumma, Vice President for Justice Services at the Community Resources for Justice, is with us. Samra Haider, the Executive Director and CEO of the Center for Employment Opportunities. Chris Steele, my friend, the Executive Director at TEAM in Oklahoma City, and the former Speaker of the House of Representatives there in his home state. So Eddie, let's start with you. Again, a council trustee, someone we've worked with, and I know your passion for this field. Eddie, before we start, you've heard what the Congressman said. What should be the federal policy priorities moving into this. Before we lose the congressman, I think it's important he knows this, but what would you advise?
Well, thanks, John, and thank you again, Congressman Scott. I really took a lot of notes of what you just shared. Some are kind of new to me, and others that I want to continue to advocate on behalf of the people that we're serving. Also, I appreciate those that are on this call, both the panelists, but also our guests, who are in the space of advocacy. And I'm sure that the more information that we're able to gather around these issues, the more informed in terms of the recommendations you want to give. Having said that, John, I think that there are a number of advocates across the country that are really pushing forward particular policies and recommendations, whether it's the Alliance for Safety and Justice, or in this case, the Council of Criminal Justice. And, given our scope of work, given what we're learning, and given what I'm going to share right now in terms of recommendations based on what the Congressman just shared, nothing is novel because of COVID-19. I mean, COVID-19 has definitely unveiled some challenges, some gaps in the way that we've been doing social services. And so, but even prior, during, and even post COVID-19, here's what I would recommend. And this is really falls in alignment with the Council on Criminal Justice, which is, we need to target urban violence reduction grant programs. And what does that mean? So it means that Congress should find robust new grant programs to be administered by the U.S. Department of Justice in consultation with other federal agencies. We also believe that to reduce the violence and victimization, trauma, and incarceration within the cities, we need to continue to think through with our legislators of how to work also with community and how to take these recommendations that it's informed by community and other practitioners to really think about how does that help support the kind of work that we're highlighting today. The second recommendation that I would like to speak on is it's around victims and survivors of crime. Often we think about victims and reentry work as two separate things, but they're often the same people that we're talking about. And so we want to continue to build on the momentum that in the last few years, our advocates and in government, we've been able to build on. So that means that Congress should reform how it funds the Crime Victim Fund, which is the CVF, and ensure the fund's long-term solvency and meaningful impact for people in communities most impacted by violent crime. And so what I mean by that is often there are so many barriers that are put forth when somebody's been a victim of gun violence or violence generally speaking. And so we're talking about victims are coming from concentrated communities, communities like Chicago and the West Side and South Side, but also communities across the country that are also grappling with this issue. While there are more recommendations that I wish I could speak on, briefly, I'll just mention that our recommendations right now from CCJ, but also with the advocates that we're connecting with, housing, clean slate, treatment programs, trainings, these are all things that are very relevant. And this goes back to what Congressman Scott just shared just a moment ago.
No, Eddie, thank you. And I think you were referencing, you and I were task force members, the Federal Priorities Task Force that's sponsored by the Council on Criminal Justice, hoping to release that report by the end of this month or soon as we have a chance to do that in these times. So thank you, Eddie, for that. We're going to come back to you in a minute with a lot you'll share with us. Let's move now to Samra and discuss a couple of things. Samra, you might start before you get to the question and tell us a little bit about what you do at CEO. But I think right off the bat, what strikes you as what's most relevant about this time, or what's the most significant thing you're working on now as it relates to this transitional employment for those coming back to society?
Thanks so much, John, and thanks for having me. So CEO is really focused on employment for people coming home from incarceration. We are in 27 cities and 10 states across the country, and so the primary programmatic intervention that we have is transitional work. So we're getting people as soon as they're released and really trying to employ them almost immediately to both give them to the immediate, connect them to the immediate benefits of work, as well as that supportive environment, which essentially serves as sort of a stepping stone into permanent employment. So while they're working for us, we get them sort of ready for work, and then we're working with employers outside of the community to hire them so that they can have long-term economic success. And so that's our priority. I think right now, what we're really interested in and concerned about, and sort of piggybacking off of what Eddie said and what the Congressman shared, is in this time, given the resource constraints happening in state and local governments, how can we work with the federal government and access federal funding and ensure that federal funding that's going to flow down to state in local governments still includes returning citizens. So for instance, Chairman Scott's Relaunching America's Workforce bill includes sort of specific language around returning citizens and transitional work. And that's really important to us because right now so many people need economic relief. We want to make sure that returning citizens in particular are not left out of that narrative and then left out of that funding. And so things like having specific carves out for our population is really important to us right now.
Well, Samra, I know I'm glad to have you in my home state. And again, we were beginning to work and get folks back to work in record numbers with your help. So thank you for that. Why don't we move now? Let's go to Chris. Chris, let me ask you. Of course, you and I go way back. We were back in the days when justice reinvestment was taking off, and some common sense criminal justice reform in our respective states. And I know you termed out, but I've been impressed by how you didn't leave this field. I think you found your calling there in Oklahoma City with teams. So tell us about, we've had a great conversation and we can't possibly cover with any of you all that we've talked about this week in preparation for this call, but I'm just struck by so many things. Tell us about the work the team's doing on the ground there and what has been most significant to you.
For sure. And John, thank you so much for the opportunity. I'm truly honored to get to participate in the discussion today. TEAM is a nonprofit, a direct service provider in the Oklahoma City area. It's TEEM. It stands for the Education and Employment Ministry. And what we do is we begin working with individuals who are impacted by the criminal justice system 6 to 9 months prior to release. And we provide cognitive instruction, courses. We provide life skills such as financial literacy, basic computer skills. We build resumes. We have a relationship with our career technology centers that we provide tangible job training. We put together case management plans, provide free legal assistance, and then ultimately help secure employment and housing for individuals as they transition back into the community. We stay with our participants for 6 to 9 months post-release. And that's what we do on the reentry side. On the pretrial side, we also have a diversion program, and we are embedded in the local county jail in Oklahoma County, the Oklahoma County Jail. And we are feverishly working when a person is arrested and admitted into the jail. We're there to do an assessment and to immediately advocate for their release, if possible, through an OR bond or through a conditional bond. And then we bring them over to our service provider location and begin the process of connecting that individual with treatment, with mental health care, with employment opportunities and housing and what have you. And it is a remarkable experience to get to be a part of that redemption process, that restoration process, that reconciliation process. And we believe wholeheartedly in second chances and in grace and in mercy. And we're pretty excited to get to be a part of helping all Oklahomans reach their God-given potential. So that, in a nutshell, is kind of how we get to spend our days and our time in Oklahoma.
Well, Chris, we want to come back to you, and I want you to be sure and share a couple of at least stories you shared with us about sort of this humanity that's on display there across the country, but clearly, right where you're doing business and serving people and their families. So we want to come back to that. Ellen Donnarumma is with us, and I know I've had a long history with CJI, and you're part of there at CRJ as well. But your work, I think what's interesting about your work, you've seen the effect. You've heard from the congressman and what kind of resources we're trying to provide, those coming from our federal prison system. So could we maybe start there? I mean, how COVID has changed the way you do business and help folks transition from BOP, the federal prison system, to communities. And you are muted, Ellen, as we ask you to do, but you gotta, this happens every single call. You just had to be the first. That's okay.
Thank you so much, John. And it's a pleasure to be part of this panel. And I love the Congressman's comments about the work we need to accomplish and the things we need to do. COVID-19 and this global pandemic has dramatically impacted the way that we're doing our work in residential reentry centers. Certainly the hue and cry that we've heard to get people home, get them out of institutions, is one that we support. And I'm hopeful that de-incarceration may be an idea that's found its time and that we'll be able to move forward from there. I'm also struck within that environment of trying to move as many folks home safely as possible, that we're left with a number of people, particularly in our residential reentry centers, who don't have anywhere to go. They are with us, finishing their sentences. They're now in the community, but they can't go home. They don't have anywhere to go. And that poses a whole different series of complications for both the operation of the center, but mostly for the individuals. Yet at the same time, I think there's a lot to be hopeful and optimistic about. I was very struck when we first began having stay-at-home orders, and to see so many of our residents in our reentry centers working from home or going to school from home when home was that reentry center, to see the computer labs in our buildings with residents being able to continue on with their work, their education, and their important reentry. So it's been a very, very interesting time. We've dramatically reduced the population in each of our facilities, and we have been able to move a number of people into the community, which has been very important as well. Quite a lot of our residents are continuing to work. They work in essential jobs. Those jobs have a wide range. We have people who are working to build ventilators and to provide and create other forms of personal protective equipment directly related to the COVID crisis. We have others who are working in food service and warehouse operations to continue the supply chain as well.
Oh, Ellen, thank you. And I know you'll have more to share on some of this, some of this changing world, and maybe some of the lessons learned and the takeaways that we can hold on to as we continue the work in this field. I'm gonna come back to you, Eddie, and you mentioned some of the task force recommendations as they relate to violence and a lot of your work. But you know, it fascinates me how you've been able to maintain the vast majority of what you do there at READI Chicago. Could you give us an example? I know maybe some of the violence interruption work. I know how you've been able to maintain that under some of these conditions which have been placed on us for our public health.
Yeah, thanks, John. So before I answer that question, there's two quick comments that I want to mention.
Sure.
And this is to kind of illustrate for our listeners in terms of who READI Chicago is working with, which is very similar to the folks in this panel as well. So READI Chicago is an 18-month program that's designed to incorporate transferable jobs, kind of behavior therapy, and support social services. And we are also targeting those who are at the highest risk of gun involvement, meaning these are individuals that are more likely to get shot or end up shooting somebody. In fact, when we think about violence prevention efforts, we don't think about victimization in the way that typically we should. And so to give you an example, on average, our participants in our program have about 17 and 18 arrests. 4 or 5 of them are felony arrests. Close to 90% of them have had a family member lost to violence. 60% of our men have also done prison time. The other part that I want to really highlight is that over 350 of our men have been victims of gun violence. So when we think about, you know, what do we do, generally speaking, in his world of criminal justice reform and work, and what are we doing in light of COVID? I think that we also have to recognize that for every population, right, there are different elements and different challenges. And so for that, right, when we think about the number of people who've been victims of gun violence, this is why when I highlighted the 2 recommendations, it is because like what READI Chicago is also teaching us is that historically these gaps that we've been seeing across the country around this population, like to say that, you know, we are working with criminal, we're working with returning citizens or those who've been involved in the criminal justice system, you know, it's very different when you work with somebody who might have a history of substance abuse or 1 or 2 low-level offenses versus somebody who, in our case, have, or 50% of our participants actually have violent offenses. So the intervention has to kind of meet to that. And now, given in light of COVID-19, you know, I would say that anybody who's saying right now that it's business as usual, they're lying. We've been able to prioritize the protection of our staff and our participants, first and foremost, to think about their safety. And that meant that we had to think about how do we regroup, how do we analyze. Our current governor here in the state of Illinois had the seat safety too as well for almost 2 months, over 2 months already. And so we were anticipating some of those challenges. And so we had a small window to go to our partners who are implementing this program in the community and right away pivot to say, hey, this is what we anticipate. This is what we're hearing. What can we have in place right now? What needs to take place? And so ultimately there were 3 things that kind of came our way. And this is also important for me to highlight that this idea of virtual learning or virtual programming, it's not for everyone. And definitely it's been a huge learning curve, I would say, not only for us at Heart and Alliance with READI Chicago, but even our partners and what we've seen even across the city and across the state of Illinois. So the 3 things that I want to briefly highlight is that right away we did a needs assessment with our participants. So we took the experience of our outreach organizations and our transitional job organizations, and we took their experience, right? And we created this tool that bi-weekly we've been leveraging with our participants to just kind of get a kind of almost like a day-by-day analysis of what's happening in their community, what's happening at home, right? Think about this. People in our program, 80% of them are couch surfing. Well, in the beginning, it wasn't a big problem. Now that they're staying in a 700-foot apartment, they're struggling. We're seeing increases in domestic violence. We're seeing, people being kicked out of their apartments. There's food scarcity. There's all these different things that are coming as a result of that. So we're trying to address that as well. The second thing that I would say is really around technology. We learned that about 75% of our staff and participants, and I could give a better breakdown, but 75% of them actually had access to technology. They either had internet or they had a phone, a smartphone. That excluded about 25% of both staff and participants that couldn't receive the kind of services that we ended up doing remotely. So we ended up doing cognitive behavioral therapy 3 days a week remotely. And that in itself has been both challenges, but also it allowed us to think about what kind of trainings and capacity our partners need, and how do we continue to build on that as well. And so far, almost two months in, I would say that's we're now managing quality of programming there as well. And that's been essentially for us, very essential for us too. And then speaking of trainings, here's the other thing. We recognize that at the end of the day, outreach workers and what we call transferable job employees in our program, they have a lot of face time with our participants, whether if it's in person, keeping distance, or through FaceTime, or even in sessions like this. So we wanted to make sure that our staff were very well versed around what the CDC is recommending, what is also Heart and Alliance, the parent company that I work for, is also recommending as well. What are the resources that we could bring? How do we dispel myths? I mean, you had some guys that were talking about, hey, if you smoke weed, don't worry about it. You're not going to catch the virus, right? Or if you hold your breath for 10 seconds, you're not going to catch the virus. So we had to train our staff to dismiss those notions as well. So there's a number of different things that we've done in that space, from even including, and this is the last thing that I'll say, even when it comes to how we're partnering with the Department of Corrections, the Cook County Jail, the Sheriff's Office, even in those instances, like how do we prepare in receiving some of those men into our program, or those who are currently on parole or on probation or electronic monitoring, how do we support them given the level of needs that they actually have?
Thank you, Eddie. Samra, let me come back to you. And you took us on a tour of all the things that are important to CEO and more specifically important to transitional job opportunities for those reentering. But if you could focus on a couple of things that you just have to have coming out of this crisis, if Congress, if you could be in the room and actually could insert certain provisions in, whether it's Chairman Scott's legislation, you clearly have a champion in him, but whether it's the CARES Act, SNAP funding, other things coming along in Congress, what would be those most important things?
Yeah, I think broadly, like thinking about the benefits access that individuals need to have. So things like making sure their SNAP benefits are intact, and then therefore can providers access employment and training funds through funding streams like SNAP. I think more broadly, it's like making sure that people are triangulating some of the systemic issues at play. So for instance, in a place like Philadelphia, you're seeing 25% increase in people released from the jail into the community, yet the city of Philadelphia understandably had to make some serious budget cuts. And so even CEO in our CEO office had to have our capacity cut by 50% because of those budget cuts. And so I think what we need to do and what we need to kind of figure out a way that we can push is to make sure that some of the response around the needs to release more people and have more people in the community is met with the same investment in reentry support. And so yes, that comes from funding streams like SNAP, that comes from the CARES Act and more funding for CDBG. But I think we need to have better communication and better coordination around sort of the overall picture for people coming home, and then the actual support network of groups that are doing that work, because there's a bit of a mismatch right now. And yes, CEO and other groups are trying to create more connection between, that mismatch, but these are huge, we're talking huge numbers here, huge cuts, and then huge numbers of people coming home, much more than the baseline. And I think that is something that CEO feels like, and I'm sure hopefully other groups here as well, we've got to understand how we're going to support the people, the providers on the ground to actually do the work in an environment where even more people are going to be released and going to have needs for more critical access to reentry support.
Samra, I may just have you answer briefly again, one more quick question. I think we all sense that without the inclusion of those coming home, being released, and those who have been justice involved, I don't think an economic recovery can work. Would you agree with that?
Yeah, absolutely. I mean, you're looking at people who are, integral. These are, as Ellen mentioned, many of them are doing sort of the essential work that's needed. Many are living in communities that if you don't have them have connection to employment, then the whole communities will continue to be distressed. I mean, this is the cycle of incarceration and poverty that's so intertwined, and now it's exacerbated by what's happening because of COVID. And I think even before this, we had difficulty accessing these funding streams for people coming home. And so again, just like with the virus itself, it gets even worse now if you don't do something drastic to support this particular group of people as members of the community.
Yeah, it seems that now that investment is more important than ever. And Chris, I'm going to come to you. I think, again, you talk the nuts and bolts as well as anybody, but you also, I love it when you can share with us something that just illustrates that, again, that this is about the people that we all serve, and our passion for the reform as it relates to the people and their families. Has there been something that's just hit you and that you'd like to share with us?
For sure. I would just say, while I have this opportunity to the congressman, one of the things that I just appreciate so much is going back and making sure that a person who may be impacted by the criminal justice system is also eligible for that stimulus check. I think it's so important that we not leave anyone behind. But I would also say that it's frustrating that in Oklahoma, at least, so much of that check is going to have to go to that person's legal fees and fines and court costs that have been assessed because they've been impacted by the justice system. And that just seems counterintuitive to me. Congressman, I know that's not your fight, that's more at the state level, but I just want the group to know that it is top of mind to make sure that we are exercising some flexibility and grace in relation to the amount of financial burden that is placed on the backs of individuals at this moment in time in light of COVID, as people are kind of struggling to either maintain employment or gain employment, and maybe facing eviction from housing and everything that we're talking about. I think it's incredibly important that we do what we can to ease the financial obstacles placed on a very vulnerable population. John, to your point, I think I would just maybe lift up the fact that in Oklahoma, and we're not unique in this regard, but several steps have been taken to try to minimize the spread of COVID within the carceral system in our state. For example, they have limited visitation. In fact, they have suspended visitation. So there's no visitation that's taking place right now in any of our facilities. It's not uncommon for facilities to be on lockdown, so there's not interaction within a common area. And we have resorted back to literally writing letters the old-fashioned way. We've gone back to snail mail to communicate with the participants that we get to work with who are still incarcerated. And I cannot underscore the impact of a note of encouragement or any means of communication that may be available, just to remind that person that they're not forgotten and that they do matter and that we will get through this together. And in that vein, the thing that we were just talking to prior to going live is just the incredible trigger that Mother's Day presented to so many of our participants who are moms and are separated from their children, or who are sons or daughters and don't even have the ability to have an opportunity to see or say hello to their mom. It has a great big impact. And as we consider how we can effectively move through this pandemic, I think it's not only important to pay attention to the risk of the physical virus, but it's also very important that we not lose sight of the emotional well-being and the mental health of the people that we get to serve and work with.
Well, no, it's well said, Chris. I'm always, again, I always note the fact that when we talk to you, you've always run in from one of the many daily chores on the ground there. So it's not just about the policy, but certainly about those you serve. And so, Ellen, I think that brings us back to you again. In this, I'm interested, and I think all of our audience would be as well, in what you see. I think sort of similar to the question I asked Samra, if there could be 2 or 3 things, the most significant things from this that you could hold on to, maybe some best practices which have emerged, or maybe it's just some changes you've had to make, which you see early positive results from. Maybe it's better efficiencies or more investment here or there. What would those things be that you could leave us with?
I first of all agree with all of the observations that my fellow panelists have made about the need for greater supports in the community and structure, and that the many people who've been released are going to need those supports more than ever, and the system's going to be strained more than ever. You know, I think the thing that gives me the greatest hope is that we have suddenly discovered that there are quite a lot of people who don't need to be incarcerated. They can be sent home, they can be sent to the community, and they can live there successfully. I think that is the greatest hope. I know in our own programs, early on, we worked with our partners at the Bureau of Prisons who've been extraordinarily flexible and helpful through this. And we talked about ways in which we could reduce some of the sort of hand-to-hand supervision activities that we partake of every day in residential reentry centers. Things like breathalyzers, things like urinalysis monitoring. Not to do away with those things completely, but to reduce them to a level that provides for less exposure for staff and residents during a health crisis. And those sorts of things, I'm hopeful that we will come out of this knowing that we can do less of those kinds of things and still have good outcomes, that we can incarcerate fewer people and still have good outcomes, and find ways to support and teach and ensure better connection to the community, positive employment that can anchor them in the community, anchor them in their families and productive pro-social circles, and also access to treatment in a changing world. While technology alone isn't the answer, technology, I think, can be incredibly helpful to provide regular access, especially as we look at a world that may never go back to what we thought was normal in the middle of February, and is going to prevent people from gathering in groups for the foreseeable future, which has been such a powerful means of change and support for the people we serve.
You know, thank you, Ellen. I think our audience too, I'm hearing that our audience is interested in sort of these carry forwards, and I think, you know, you stated those well. Eddie, let me come back to you briefly. I mean, could you identify a couple of those lessons you've already learned in this brief time? I mean, I think we all would agree with what Ellen, those of us who've worked in this for some time would all agree with all those sentiments, and those from Chris and Samra. What would be those takeaways briefly from you?
Yeah, John, so let me just share full disclosure, right? So I am someone who spent over 14 years in prison. I've been home for the last 11 years. And I've been very privileged to manage some of the largest anti-violence programs in our city, doing policy work, advocacy, organizing, and so on. And so I've been very intentional to make sure that the 100+ staff that we have in READI Chicago, that 80% of them actually have very similar experiences than I do. And so the question for me is, we want to make sure that we continue to keep our staff safe. Many of them, like many of us on this call, right, feel compelled to extend themselves, to put themselves at risk. And I think it's part of my job and part of those in leadership, right, to really think forward about what's your strategy moving forward. Like, how do you maintain programming? Because there's also an obligation, not only for the people who are financially supporting you, but there's obligation to the people you're serving. And so, which often is more driven by the people who are on the ground doing this work. So it's really continuing to inform them, to provide them tools, to train them. Those trainings could vary. I'm happy to share about some of our trainings that we're sharing that would be more than happy to say, hey, here's what seems to be working for us. But to demonstrate an example of what is working for us is communication. As Samara pointed out, communication is really, really critical for us right now. Streamlining it, getting information right away to our staff and our participants, ensuring that if we're talking about trauma-informed approaches, that we continue to think about, how do we support our staff? Here's a case in point. We did a very small analysis of some of the staff who are doing this work. We learned just in one site, just in the west side, just in the south side of Chicago, that about 30% of our staff there were single parents. Now think about this for just a minute. My wife, she works for the Attorney General here in Illinois. We have 6 beautiful kids. We struggle tremendously to balance our work obligations with our family. And that's 2 adults here. Now, I can only imagine how much the struggle is for a lot of our frontline staff who often had to have a second job or a part-time job, or then in many cases, what we're also learning and seeing that their spouses, their partners have also lost their job. So there's an added pressure there, right? Stress that in my position, I have to be cognizant of that and think about what are programmatic decisions that we can make right now. How do I think about the next 6 months? Because we're not going to be able to go back to square one. And we got to think about what did we learn? What did we learn through the technology that we could potentially continue doing in the months to come? And for us, cognitive behavior therapy is one way that we plan on doing. The second thing is really about our safety assessments around that we learned that a lot of our guys coming into our program, about 70% of them still feel comfortable coming to the work site, despite the fact that they had to cross gang boundaries. That left about 30% or so of individuals that they're like, hey, I'd rather do some work from here from my house. So those are things that we're also learning. How do we incorporate that as well? And then lastly, John, that I'll point out is what are we also learning through gaps of research that COVID has actually unveiled for us? And again, I want to continue to advocate for this population who are typically, more likely to be victims of gun violence, only because we continue to marginalize within the marginalized when it comes to criminal justice work. And here's what I would say is that in addition to the gaps of research that we're seeing right now, what are policy implications? What are collateral consequences policies that we've seen right now that the advocates continue to champion in this space right now? And I could tell you that this is why we're working closely with the Department of Corrections, because we see opportunities there around housing, for example. There's just not enough housing opportunities for our men right now. And so, luckily for me, I work for a large organization that has housing components there, but we can't meet the demand. So there's a lot of work that needs to be done there moving forward, whether it was COVID or not. But definitely COVID has unveiled some of these challenges for us.
Well, thank you, Eddie. I want to get to a couple of more questions, and they are coming in from our audience. Again, hope to be speaking to what is a really informed and educated group of leaders and voices in the field who are listening in. So, one of those would be, and I'm going to ask you first, Chris, and then I want Samra, if you would take the same question, I can repeat it. But I know, these challenges, what give us specific examples of how COVID has changed your response to some of the daily challenges. In other words, how are these challenges complicated by COVID, and how do these responses differ?
Sure. So the reality is, I think Ellen did a great job of sort of articulating tangible things that we've seen a change in. So we have moved away, for example, from urinary analysis. We're not doing that except in very limited situations. We are staying in communication through telephone, through text messaging, through video conferencing, and it seems to be working extremely well for the most part. And I think in Oklahoma, one of the most tangible things that we're seeing is that individuals, participants are given some grace from law enforcement in relation to technical violations. We're not bringing people in. We're not rearresting for technical violations. We're not arresting people for things that we normally would arrest them for. And we have not seen an increase in our crime rates. In fact, we've seen a reduction. We've experienced a reduction in our crime rates. And I think the reality is this: we're learning that there's a lot of components within our current criminal justice system in Oklahoma that just are not necessary. There's no reason to do them. And I think that there may be ways for us to move forward to sustain some of the changes that have occurred. We are actually in better communication with employers who need employment, grocery stores and distribution centers and big box stores. And they have started to realize, hey, wait a minute, we can employ somebody who may have a criminal record. And it turns out they're really good workers. They're hard workers, they're dedicated, they're hungry to do a good job. And so I think it's challenging some of the stereotypes that may have been misplaced in our state in relation to how we think not only about some of the practices that we've been doing for decades, but also how we feel about individuals who are valuable contributing members of society.
Yeah, good. Samra, again, that's a tough act to follow, but I know you can do it.
I'll try. Yeah, as I mentioned, a big part of what CEO does is operate transitional work crews. And so that is not something we can take remote. It's real work that we do. And so initially the goal was to preserve the work crews, have them keep running. As stay-at-home orders or shelter-in-place orders came through, for us it became kind of difficult, because I think we were faced with this question of whether we allow our participants to work and earn important money, or do we think about their health, safety, and shut the work crews down. And without a playbook, without any sort of benchmark or anyone telling us what to do, that was a real challenge for us. And in an organization, as I mentioned, that we have so many different sites, in some cases we made different decisions based on the jurisdiction and the prevalence of the virus and things like that. And so that was really challenging. And then to add to that, for the crew, we were happy that a lot of our crews were able to stay open and working. We had our supervisors, who are usually focused on performing the task at hand, having to also be the front lines for what our normal coaching staff would do. So we might have participants that are having more severe mental health issues or having more difficult issues that normally a job coach would support with on site right there, and they're working from home. And so that connectivity was a little bit more challenging and dealing with the exacerbation of issues happening for participants, and it was coming down on some of our staff who were out in the field. And so that became pretty challenging. But I think one thing that has been really great is the way our staff that's working from home supported our staff that were still out working on our work crews. And it really actually, I think, improved the camaraderie and connection between our own team.
No, again, it's easily seen. Ellen, I'm going to come to you. One of our audience questions, if I can articulate this properly, but I think it's an excellent question. How can the federal government, or even if you want to extend that to state governments, help you and what you do and what your organization does be a little more nimble in responding to COVID and more effective at protecting, not only the public health of those around you, the health of those around you, but at just being more successful at what you do, your core mission?
Well, we couldn't do any of the things that we do or accomplish any of the good work we do without our staff. And our staff are incredible. They have truly been magnificent before COVID, but certainly through this crisis. the kinds of support that our staff deserve and have earned need to be recognized. And I think that's everything from better funding for community-based programming, which I know is going to be extraordinarily difficult to obtain going forward with what we're facing. But really just the recognition of the importance of the work and the proper funding, both through COVID and beyond COVID, acknowledging that our staff are essential to the work that we do.
Yeah. Well, you know, again, panel, understanding we just have 2 or 3 minutes left. We want to tag out on time as we promise everyone to do. I think we've covered the gamut. You've taken us across here. But again, I would ask any of you, not asking any of you specifically, but is there anything, a key component of what you intended to say we've missed today? Something you leave this audience with? Again, another takeaway, something you think is critical that everyone know moving forward. Maybe an anecdote that is worth sharing in our last couple of minutes before we conclude. And please raise your hand, and I'll call on you if you don't. You know that. So, Chris, what about you? I guess got to be something.
Sure. So I would just maybe lift up again the great thing that's happening for Oklahoma, who for whatever reason has created a system, a criminal justice system that is heavy on punishment and retribution. I think COVID has really allowed us to remember the dignity, the humanity, the value of fellow human beings in this situation. The reality is people are now starting to say, hey, wait a minute, there is no such thing as a spare Oklahoman. What are we doing to make sure that everyone is safe? And just the connectivity of understanding that if there is an outbreak in a carceral situation, that ultimately affects all of us. And the other thing that I have heard said that warms my heart and gives me hope is that people are beginning to really sort of couch the situation like this. All of us need all of us to succeed. And I think just that spirit of understanding that we're all human beings, and just because somebody may have stumbled somewhere along the way doesn't mean that they're any less of a human being. You know, this person has value, this person has talent, this person has gifts that can be used in a mighty and wonderful way to enhance the quality of life for all of us. And the fact that we need each other, I think, is probably the silver lining in light of the pandemic we're facing right now in our state.
Well, Chris and all the panel, I can't think of a better way to end the call. We certainly want to thank the Congressman Scott, for taking his time. I know he or his staff is still listening in as they promised they would. They've been an ear to us at the council and beyond for years. And so we thank them. What a distinguished panel we had today. Our audience just as distinguished. Again, thank you. We had hundreds on the call today. And please stay connected with us through our social media options. You can get a recap of this call like all the others from our website or social media, a written recap and a video recap as well. And stay connected to us because we intend to announce, as we mentioned, the Federal Priorities Task Force report, hopefully in the next couple to 3 weeks at the end of the month, we hope, and then another call just like this to continue our series. So with that, we hope you all stay safe and well, and good day to you all.